medicine, that means that I see everybody from the moment they're born on. So I see all ages. I'm your primary care doc, if that's a term that you're more familiar with. I see a lot of chronic disease, acute care. But being lifestyle medicine board certified, I really see most of my patients through that lens of how are you eating, moving, sleeping, what's your stress level like, your social support. I'm looking at a person from an entire picture, right, as a whole person, as opposed to just one set of symptoms or one disease process. So that is really how I approach patient care. I own a direct primary care practice in Shadyside called Direct Care Physicians of Pittsburgh, and I own a wellness center next door to it where we are the only woman physician-owned lifestyle medicine center in Pittsburgh. So it's really fun. We have a plant-based teaching kitchen there where we do culinary medicine workshops. We have group fitness, yoga, personal training. It's truly a dream because, as we'll learn today, the vast majority of disease that we see in this country is related back to lifestyle. And so we need to be honing in on that, right? We are really good in medicine at treating disease with medications, interventions, surgeries, and there's a place for those things, but we would be remiss to not focus on lifestyle as well. And today we're specifically talking about nutrition. A couple of disclosures: I do lead a plant-predominant lifestyle, so that's the background I'm coming from. I also have 2 kiddos and a husband. We all eat that way in our household. I do own a plant-based teaching kitchen. I am on the board of Plant-Based Pittsburgh, and I am not a dietitian. So, we do not learn a lot about nutrition in medical school. So much of what I learned was through lifestyle medicine board certification process and patient experience. So I think those are important things for you to know, table setting where I'm coming from. I would love to know where you all are coming from a plant-based perspective. How many of you are already, let's say, whole food, plant-based, 100%? That's awesome, great. So we've got people who are going to learn something new today then, for all of you who didn't raise your hands, right? And that's where I feel like the secret sauce is, right? If we can all learn, even take away one thing today, my job is done. That's great. Learning objectives, we're going to talk about heart disease. We're going to talk about some of the leading causes of heart disease. We're going to understand how nutrition can improve our heart disease risk, and on the flip side, how nutritional factors can also increase our heart disease risk. And we will talk about some simple ways that we can incorporate these nutrition-based strategies into your daily life. All right, so let's talk about the global burden of disease. This is a lot of words, and I'm going to tell you what to take away from it, okay? So this chart is talking about a projection toward 2050 from data in 2022 about the leading causes of death across the world, okay? And so those in the United States somewhat mimic those globally. When we're looking at these pink ones, these are what are called communicable diseases, nutritional diseases. We see these in third world countries, right? These are infectious diseases. And there are some that are up there, okay? Some of these in pink are up there as leading causes. The blue ones are the ones that are what are called non-communicable diseases, or the ones that we see a lot, like high blood pressure, stroke, heart disease, as we're talking about today. And when we look toward that projection in 2050, look at the blue. It starts to really take the lead globally. Now, that's really important because most of these blue disease processes in some way can be traced back to lifestyle, right? And lifestyle habits, in particular, nutrition. Next slide. So cardiovascular disease, there are going to be some big words that you hear when you read about heart disease, right? I think it's important to talk about some key definitions and break down some of the question marks we might have about these big words, right? We have a whole different language in medicine. Key definitions here: cardiovascular disease, a short term for that would be CVD. This is a really broad umbrella terminology. Cardio means heart, vascular means our blood vessels. And so these are all kinds of different diseases that can happen with our heart and blood vessels, like heart failure, stroke, heart attack. And these are things that we see day in and day out across our country. Ischemic heart disease, that's a really fancy word for the vessels are blocked, okay? This is I had a heart attack, I had a stroke, right? Ischemic heart disease specifically is that heart attack. And this is a type of cardiovascular disease. Atherosclerosis, some of you may have heard that word before. This is that clogged arteries, right? So I've got hardening of my arteries, I've got plaques that are forming in the arteries, okay? And the more that these plaques form, the more unstable they become, and that's when they ping off, and and they can cause things like heart attack and stroke, okay? Atrial fibrillation, which I know Nedra's going to talk about later in more detail, but this is one of the potential causes of heart disease, like heart attack, stroke, heart failure. This is an arrhythmia. So this is a problem with the way the heart is working with its electricity, okay? So these are just some key definitions that you might hear mentioned, and you'll be able to watch back on this, and I can send my slideshow to Sally for you to look back if you'd like to for a reminder. Next up, with cardiovascular disease, who's actually at risk for it? A lot of people. I mean, it's a leading cause of global burden of disease across the world, right? So there's a lot of things that can lead to it happening. Statistically speaking, as we age, that risk goes up. If you have high blood pressure, if you have high cholesterol, if you have specifically this pattern of a high LDL, which is bad cholesterol, and a low good cholesterol, or HDL. People who have excess alcohol intake, smoking, people who are dealing with excess weight. How about people who have kidney disease, diabetes, insulin resistance, people who have a family history of heart disease, people who have chronic inflammatory conditions like rheumatoid arthritis. So that list is exhaustive, right? That's a lot of people who are dealing with some way, shape, or form. I'm sure if it's not you, it's someone in your family or a friend who has something that's up on that list, right? So the risk of heart disease, it's not surprising that we have such a high prevalence of it because most people have some type of risk factor for it. Pathophysiology means how does it develop? Okay, how does heart disease even develop in our bodies? Because interestingly, I'll get CT scans on a patient for some other reason, right? I'm not looking for their heart. I'm not looking at their heart. I'm looking at their lungs, for example. And you see what's called an incidental finding of plaque in the arteries. Maybe some of you have experienced that, where you see a CT scan result, and they say calcifications in the coronary arteries. Big fancy word for there's blockage in those arteries. You didn't even know you had it, right? Again, this is an incidental finding, and we see that as people go through life, these things can develop, and you don't know it until you know it, right? Until something bad happens, or you present with chest pain, shortness of breath, a heart attack, right? High blood pressure, inflammation, those plaques in the arteries, these are what are leading to the development of cardiovascular disease. And it's important that we talk about a few things today, which is the role of nutrition in how that's developing. Specifically, the relationship between LDL, that bad type of cholesterol, and the plaques forming in the arteries. Specifically, saturated fat, trans fat intake. Specifically, processed foods. And again, these are things that we're seeing all the time in the food that we're eating, the food that's readily available, and the food that we're regularly fed throughout most of our lives in this country. So, dietary factors, I am not a huge fan, so another disclosure, I'm not a huge fan of good and bad as general terms, because I find that when we start to demonize stuff, it's really hard for people to stick with that and find that sustainable, because the moment they eat something bad, they're off the rails, right? But I think it's important to understand along a spectrum that there are dietary factors that are far more optimal or desirable in a dietary pattern than others. And if there's one takeaway you have from today, it's the pattern that I would love for you to work on and work toward. And that's a pattern that's high in fiber, a pattern that's high in healthy fat sources, which we'll talk about, high in plant-based food intake, high in antioxidants, and lower in our added sugars, refined processed carbohydrates, processed meats, right? So along that spectrum, the majority of you did not raise your hands today, right? So any of you, I'm sure, I could definitely work on moving along that spectrum toward those more beneficial categories of dietary factors. Main point, eat more plants. All right, see you guys later. Have a great day. All right, we're going to talk about plant-centered dietary patterns. Honestly, having terminology, for some people they find that's helpful for their guardrails around making food choices, right? I eat this way, it helps them make choices on a menu, it helps them when they go to a party, fine. Some of you may not like to have a name for how you eat or what your dietary pattern is, right? And that's also okay. These are some common names of dietary patterns that we see that are what I call plant predominant, meaning that the majority of what you're eating is plant source, okay? So vegetarian, right? These are typically featured by no meat, They may have fish, they may have eggs, they may have dairy. We move toward a Mediterranean dietary pattern. This is more of our plant-based fats like olive oil. Sometimes there's fish, some lean poultry, some dairy, but it really limits red meat, processed foods, added sugars. Whole foods plant-based is what you're going to hear a lot about today, right? This is our dietary pattern that excludes animal products. It focuses on whole, unprocessed foods, and is really focusing on plant protein and fat sources, so we're getting it from our plant sources. And I was just reading another study the other day that showed switching even the ratio of your plant-based proteins to animal-based proteins, or your plant fats to animal fats, the more we can shift that ratio toward the plant sources, the better when it comes to all-cause mortality, meaning risk of death early on, risk of death from heart disease, right? So shifting that ratio is really helpful. And so I think as we move a little bit toward this way, right, we can have a dietary pattern that is going to be more helpful for our heart health. Let's talk about the science. All right, so key studies that have come out talking about heart disease. You can look in great detail in this, but I'm assuming we're not at a scientific conference this morning, so I'm not going to get into serious statistics. But the Adventist Health Study, for example, this is a vegetarian population, lower heart disease rates. Epic Oxford Study, those that were plant-based eaters have a lower risk of that ischemic or clogged artery heart disease, so heart attack, okay? Ornish studies, Esselstyn, no, I spelled that right. I'm going on very minimal sleep. On Esselstyn and Ornish's studies, looking at reversal of heart disease through plant-based food intake and that higher whole foods plant-based approach, reversal of heart disease, that's amazing, right? Again, global burden of disease being that high and we can have reversal or at least decreased risk of recurrence, absolutely huge. And this is through food. All right, let's talk about key players today, and this is where I want to get into the nitty-gritty of what we're going to learn about with regard to nutrition and diet and heart disease. I want to talk about cholesterol, I want to talk about antioxidants, I want to talk about fats, fiber, and omega fatty acids. And we're going to talk in detail about each of those. Let's kick off with cholesterol. So, true or false? We can go to the next slide. True or false, cholesterol is not important for the body at all and we don't need it? False. False. We do need cholesterol. Now, interestingly, our body produces all the cholesterol we actually need, which is really cool, and then it's really good in most cases at getting rid of what we don't need. And what we don't need usually comes from external sources, like our diet, and some of what we do need can be hard to get rid of when we have certain conditions like familial or genetic high cholesterol, or people who have dietary patterns that are really high in cholesterol intake. Now, cholesterol is very important for hormone production, so think estrogen, testosterone, vitamins like vitamin D. Our body needs it, but again, it makes what it needs. Cell membrane structure, this is definitely an important part, but it does not necessarily need to come from our dietary pattern. Next slide. So, the studies are interesting when it comes to cholesterol because nutritional research, I think it's important to understand, is really hard to do. Who here is good at remembering what they ate last week? That's awesome. I'm not. I think it's really hard on a big population study from a public health perspective to do nutritional research, especially when we have human error of how do we remember. You know, a lot of times these are questionnaires where you ask people retrospectively, what did you eat? It's challenging. People are not great historians of what their dietary pattern is. And so it's hard to find specific studies that just nail down a dietary factor and how it affects disease, right? Because there's other things at play. Remember, I'm a lifestyle medicine doctor, so just focusing on nutrition is not enough. How are you moving? How are you sleeping? What's your health history from a mental health perspective? Like, there's so much more. So it's hard to find studies that definitively say that dietary cholesterol is automatically going to increase your heart disease risk. But there are ways that we see the writing on the wall, right? And the writing on the wall is, when we have high intake of dietary cholesterol, okay, that can increase our LDL levels. And when we increase those LDL levels, or that low density lipoprotein, that bad type of cholesterol, that is linked to increased heart disease risk. Okay, so it may not be that exactly dietary cholesterol equals bad, equals heart disease. But there are patterns that develop when that intake is high enough over time that we start to see that increased risk. Animal sources of cholesterol, it's the only place you're going to get it. So these are eggs, especially egg yolks, fatty meats, processed meats, organ meats, full-fat dairy. We're not getting it inherently in plants. It's not inherently in there. But it's important to note that when we are eating foods that are, labeled plant-based, but they're maybe labeled like a processed vegan dessert, okay? And you look at the ingredients label and you see things like coconut oil or partially hydrogenated oils. These types of oils are really high in saturated fat. And there is a connection between that saturated fat and increased levels of cholesterol in your body. So again, we can make some of these leaps to say if that overall pattern can be lower in saturated fat, right, or lower in cholesterol, then we can assume that there's going to be a lower risk of heart disease over time. Antioxidants. That's a buzz term. Everybody loves to talk about antioxidants. Antioxidants are super important in our bodies. Reactive oxygen species, when you read about antioxidants, you will see this word, okay? Oxidation, you'll see some of these words in the literature, okay? They play actually a really important role in our body. We need reactive oxygen species for our body to work properly. But the problem is when we have too many of them. And when we have excessive oxidation, all of a sudden those vessels that we have in our body aren't working too well. They become damaged, okay? And we need those vessels to dilate. We need them to open so the blood can flow. It's plumbing. It's plumbing. It's very simple. And when that plumbing is clogged up, or when the pipes are all hardened and not working as well, that's when we start to have a problem with our heart health. Inflammation. Start to have an increase in inflammation in the body, which is increasing our risk for heart disease, heart attack, stroke, heart failure, etc. And when we have an excess of those reactive oxygen species, we start to have formation and then rupture. Remember that picture of those plaques building up? When I said they become unstable, that's what I'm talking about. They rupture off, and in that inflammatory state, again, that's going to lead to an imbalance in the body that increases our risk of cardiovascular disease. Now, you hear a lot about people wanting to take antioxidants, right, or supplement with antioxidants. There's such a thing as too much antioxidants. And in reality, the best thing we can do is get it from dietary sources. If we can take it from a dietary source that's in a much more controlled environment than a supplement, right, that's our optimal approach. These are some key antioxidants. So vitamins C and E, so think your citrus fruits. I just got like some fun examples here. Dates. I know that Brittany's gonna cook with some dates later. Polyphenols, so berries, that's an antioxidant from berries. We love berries. And then carotenoids or carrots, that's how I always remember that one. So carrots are high in carotenoids. These are great antioxidant sources. And these antioxidants help us to remove those excess oxidative stress in the body, right? And decrease that risk of heart disease. Okay, fats. This is another one. Fats are the enemy this week, next week they're okay. It's really hard to keep track of. I don't know if you feel like your head's on a swivel with regard to nutrition recommendations. Again, it's the pattern that I want to talk about today. It's the pattern and it's the sources, okay? So let's start over here, saturated fats. We're talking about full-fat dairy, coconut oil, palm oil. Gosh, these are in a lot of processed plant-based products, like a lot. If you look at the, and again, keyword is processed here. These have a tendency to increase our total cholesterol, and in particular our LDL cholesterol. There are links between saturated fat and problems with blood sugar and insulin sensitivity, right? So if you've heard of prediabetes, in my pre-diabetic patients, in my diabetic patients, I'm recommending lower saturated fat intake. What does that have to do with heart disease? We learned insulin resistance, diabetes, big time risk for heart disease, okay? Every time you have a diabetic patient, you end up putting them on a handful of medication. Oh, this guy went away. A handful of medications automatically, one of them being a statin, to lower your heart, to lower your cholesterol, right? So this is important, saturated fat intake, especially in certain populations. Trans fats, they're so, 20 years ago. Like they're gone from a lot of foods now, but they're still out there, and these can be very inflammatory. They can increase your LDL, they can lower that good HDL, they can increase your risk for heart disease, and a lot of these are in partially hydrogenated oils, fried foods, baked goods. MUFAs and PUFAs, those are kind of fun words to say. So monounsaturated fats, so right, we learned about saturated, now unsaturated, we move toward this side of things. Monounsaturated fats, note I said be careful of the sources and the amounts, because I have a lot of patients who eat nuts. Cool, all right. But then it's like handfuls of nuts all day long. And there is such thing as too much of a good thing when it comes to fat sources. And so we do know that when we're replacing some of those saturated fat sources with our monounsaturated fats, that can lower LDL to a certain point, okay? But again, too much of it can start to increase that risk of that plaque developing, of heart disease, okay? So we want to make sure that we're focusing on the avocados, the nuts, in reasonable amounts throughout the day, and it not be the only thing you're eating all day long, okay? Same with omegas, or PUFAs, or polyunsaturated fats, and we'll talk in detail about these. Some of these sources are really high in what are called omega-6 fatty acids. That's different. If you've heard of omega-3s, people talk about omega-3 fatty acids, right? Well, there's omega-6s, and when we have really high amounts of these, sometimes it can cause an inflammatory state, okay? So foods that are really high in sunflower oil, corn oil, soy, that's the first ingredient on some processed foods, right? These are ones that we want to minimize, right? And the ones instead that we want to focus on are like our walnuts, our flax seeds. These can lower our LDLs. I mean, walnuts, flax seeds, chia seeds, hemp hearts, literally I prescribe them to patients. You know, like let's do a spoonful of these. You can start with that in your smoothie each day. And these are incredible sources from food, not a supplement, of omegas, specifically the omega-3s. So omega-3 fatty acids, there's a couple of types of them. I always find this confusing, so I wanted to break it down in case any of you find it confusing as well. So there's a type of omega-3s called ALA, alpha-lipoic acid. This is plant-based omega-3 fatty acids. These come from a plant source. And these are in our chia seeds, walnuts, flax seeds. I have a good friend I trained at Mayo Clinic for my residency, and I have a good friend who's a neurologist there, and so he's all about cognition and brain health. And he eats what does he call it? It's like everlasting life salad every day or something. He has some word for it. But it's all like walnuts, chia seeds, flax seeds, along with all the vegetables. So I try and keep them in my mind every day. I'm like, I just have one of those salads every day. These omega-3 fatty acids, specifically ALA, they have, in the literature, a modest effect on LDL lowering, okay? So it's not profound, significant LDL lowering, but it is something that's important to note. In particular, triglycerides as well. I have a lot of patients who have really high triglycerides. Triglycerides are a type of fat in the blood, okay? So they're not cholesterol, but they're a type of fat that we have in our blood. And many people have high triglyceride levels, whether they have high blood sugar that can cause that, maybe they have a familial condition that causes it. And we do sometimes use omegas as a way to lower triglycerides in these patients. And so we do see this anti-inflammatory property to ALA, and it might reduce the risk of cardiovascular events and arrhythmias. Again, hard to nail down with nutrition research that this is the answer, right? But again, it's about the pattern. But there are two other types of omega-3 fatty acids, and these are the ones that are primarily from our animal sources, so our fatty fish, or if you've heard of someone taking a fish oil supplement, EPA and DHA. So let's go through this. They really do reduce triglyceride levels a lot, okay? In fact, again, it's one of the things that we use to treat it. Now, in my plant-based patients, we go more for an algal oil as their omega source, as opposed to a fish oil. So ALGAL. They can be a really important part of reducing cardiovascular disease. They can be anti-inflammatory. They can decrease your risk of clots. So that's what antithrombotic means. They can actually help, in some instances, with heart arrhythmias. But here's the catch, and that's what I wrote down here. First of all, that antithrombotic, meaning that it decreases clot, they actually have an increased bleeding risk with too much of them, okay? When people go on excess supplementation, I'll just talk loud. Excess supplementation of these omegas, you can have an increased bleeding risk, so that's really important.